Parents, if there is one thing that I wish I could communicate to everyone that we get to interact with, it is the huge connection between birth trauma, birth intervention, early childhood toxic exposure, and how it affects the vagus nerve. The vagus nerve is the most important nerve in your body. It controls so much of what you need to function as a human. Sleeping, eating, emotional regulation, optimal growth and development, focusing. There's nearly nothing that is not touched by the vagus nerve. So when those early life factors affect it and influence it, it can show up in a whole perfect storm of different challenges that leads to kids struggling in a bunch of different ways. And that might be early colicky, fussy, stressed out baby things, or it might be those higher level neurofunctional things like autism, ADHD, anxiety, sensory processing disorder, and even some of the stuff that's becoming more talked about recently like POTS or PANDAS. So let me walk you through how are those things all connected and how is it that the vagus nerve is thrown off and how is it disturbed. So vagus nerve dysfunction, like I said, often starts with those two early challenges. Birth intervention and birth trauma are the biggest ones that aren't really talked about at all. Even people that are looking for toxic exposures and know that that's a problem, we're maybe missing the fact that if you pull a baby out by their head and neck, if we create a lot of torsion and rotating and tension up here, it's going to impact them. That vagus nerve is a cranial nerve, comes out the base of your skull and runs right by those first couple cervical vertebrae. So just a small amount of pressure, a small amount of impact on a baby is going to affect how this area of the nervous system is working, which is going to turn down, affect, and negatively impact the vagus nerve. So that's one. The other thing is the vagus nerve is extremely sensitive to early childhood toxic exposures. Maybe that's antibiotic use or medications or other negative things that they're exposed to. The more that their gut, their GI system has coming its way that it's not supposed to, the more that that's going to skew that vagus nerve as well. So what that does is it knocks their body's balance system of stress versus growth and development. It knocks it off, pushes it more into that stress and survival mode. Early on, that shows up with a stressed out baby. They're colicky, they're fussy, maybe not latching, not feeding well, spitting up, constipated. That can show up as a whole lot of different ways, but that is usually the starting point. It's a stressed out baby. What are you told? Don't worry, they'll grow out of it. Sadly, that is not the true story. We see time and time again, kids that are dealing with that early on, they don't grow out of it, they just grow into the next iteration of those issues. So instead of not dealing with any other health challenges, now that shows up delayed milestones. Maybe that's communication isn't happening. Maybe that's motor stuff, right? They're not crawling, they're not walking, they're not moving as they're supposed to because their body is so tense, it's so rigid, it's so stiff. So those missed milestones are the next thing that we see show up. Early on, it's pretty much just motor stuff, but then it is more of emotional regulation, it's higher level neurofunctional things, which is where as the kid gets older, how these symptoms manifest continues to change as well. Because now as a school-age kid or as even like an older toddler, we're expecting them to have some more ability to focus, ability to regulate their emotions, not completely lose it all of the time. And if they're still stuck in that stressed out survival mode, if their vagus nerve still isn't working, they've got no chance of those things going as they should. Even just this week, this morning I was talking with a mom of a kid who is dealing with PANDAS and sensory and emotional regulation issues. We're only 3, starting 4 weeks into care, and she is in near tears talking about how much life has changed and how easy, that's the word she kept using, how easy life is to deal with her kiddo that was struggling, which makes life with the other siblings and the other kiddos a lot easier too. So we need to address that cause because if we don't take care of it at that point, this keeps developing. And now those neurodevelopmental issues like ADHD, anxiety, autism, POTS, PANDAS, all of those, which are deeply rooted in neurological stress, now that becomes that kid's norm too. The cool thing is, a couple cool things. One, we have technology that can measure it. In 3 to 5 minutes at the office, we can test it. We can see how your vagus nerve is functioning. If you're stuck in stress, if you're stuck in survival, or your body's in that more optimal development state. And then the cooler part, because it's cool to be able to test it, it's cooler to be able to fix it and do something about it. That's what care does. That's what adjustments do. It pumps the brakes, turns that vagus nerve back on, allows their body to be in that optimal growth and development mode again. So if that's intriguing to you, if you have more questions on that, there's an article in our bio you can check out on vagus nerves. And we would love to have you come in, have your kid come in, get scanned, and see if there's something we can do to help your family be at their best. Have a great day and look forward to meeting you soon.